The latest surge in coronavirus cases leading to a wave of patients in the hospital, with healthcare workers calling it a war. There's a renewed push for vaccinations.
We're tired, we're exhausted as a staff, as a healthcare facility. Our patients are younger, they're sicker.
A local doctor and a local faith leader joining us today, pressing the need to protect your own health and your neighbors. Plus, summer school for city council. That means working the details of a budget proposal.
We're proposing $500 million of projects that touch every corner of this city.
He's the chairman of the Finance Committee, and Jacksonville's Dr. Ron Salem is with us on This Week in Jacksonville. And glad you're with us today. So COVID-19 cases, they continue rising throughout the country as the Delta variant shows the cracks in the armor of the unvaccinated. In 1 week in Jacksonville, UF Health saw the number of patients hospitalized with coronavirus more than double. Almost all of those patients, we're told, are not immunized. Joining us today in studio, Pastor John Neman from the Sanctuary at Mount Calvary Missionary Baptist Church in Jacksonville. And on Zoom, Dr. Nancy Staats, a board-certified anesthesiologist who managed surgery centers for 27 years. So I understand both of you were participating in a town hall Thursday. Tell me the purpose, and Dr. Staats, if you'd begin, what do you hope to accomplish in that meeting?
Right. Well, thank you, Kent, for having me. What our main goals are is to make people aware of what's going on in the hospitals. There seems to be a disconnect between what doctors and other healthcare workers are going through right now in Jacksonville area hospitals and what we see in the average business and other locations throughout the city. So we need to be cognizant of what is going on, which is a lot of people getting sick, unfortunately, and straining our system.
Yeah, Pastor Neman, I'd love to hear. You're moderator of this event that was this past Thursday. Yeah. I don't want to say what's in it for you. What's in it for all of us is people getting vaccinated and getting a handle on coronavirus. What were you trying to accomplish there?
Well, the same thing as Dr. Staats had said, but also we have to recognize as people from the faith space that our responsibility is to protect or support the common good. And this is a virus that has no respect of persons. This variant is very virulent. It is extremely transmissible. They're saying 225 to 250 times more, which means that now it's not a 15-minute conversation. It can be just a breath from someone who is shedding, and you may be infected.
How about that?
So it is just extremely important that we get the message out in every community. Your life is sacred. It is special, and we care. We love you. And if you love yourself and those whom you love, get protected, get vaccinated.
Yeah, I want to talk about this. Hospitals we've seen in the last couple of weeks, suddenly they are overwhelmed by cases. Even this week, we've been inside places like UF Health and their ICU. Homeless shelters, we're told, are going back to reduced capacity, to screening, to social distancing. So, Dr. Staats, obviously there are adjustments being made. Do you agree with those kind of things, considering that vaccination is almost stopped? It feels like people just aren't going to get vaccinated as much as they were in their first month that vaccines were available.
Right. Well, we're looking at a couple of issues. One is, I think the initial Delta or the initial COVID variant did spare to a degree younger folks. Children were not affected so much, young, healthy adults, not so much. This Delta variant, as Pastor Neman just said, is much more virulent. It is easily transmissible, much more so than the first one. It has less regard for your age. So we are seeing not only children, but young adults in the ICU. They are succumbing to the virus. They are in the prime of their life, and some leaving behind young children. And it's, frankly, as a healthcare provider, it's tragic. It's truly tragic.
Yeah. This week we saw Jacksonville Mayor Lenny Curry directly addressing the crisis. In the Jacksonville region, as we're seeing, has a higher percentage of cases and fewer vaccinations than any other major metropolitan area in the state of Florida. Why do you think that's the case, Pastor Neman?
Well, I think you're dealing with human nature, for one thing, that people have gotten kind of like COVID tired, COVID fatigued. And they've gotten kind of used to, after the late outbreaking of earlier or I'm sorry, they were outbreaking earlier this summer, spring, summer. Now people started getting used to their lives being back to normal, and they want normalcy so bad they seek homeostasis. So now with this variant coming to the fore, people are just resistant to changing what they're now calling their freedom. They don't want to go back to wearing masks. They don't want to hear anything about mandates. They're afraid of all that. The most important thing for them to recognize, though, Kent, is that this particular variant is so lethal that it is taking no prisoners, and they must protect themselves. It is imperative.
We had reached out, I know, from our newsroom to the office of the governor. We had been asking Florida Governor Ron DeSantis if he was going to speak on it. He did this week, and very strong support for vaccines. As a matter of fact, he spoke on the surge of cases during a news conference in St. Pete, and I want you to hear this. He insists that the benefits of the vaccine outweigh a small risk of side effects.
Here's, I think, the most important thing with the data. If you are vaccinated, fully vaccinated, the chance of you getting seriously ill or dying from COVID is effectively zero. If you look at the people that are being admitted to hospitals, over 95% of them are either not fully vaccinated or not vaccinated at all. And so these vaccines are saving lives. They are reducing mortality.
Dr. Staats, I want to hear from you. How important is it for, whether it's people in Jacksonville or throughout the state, to hear the governor in this case say, do it, it's important, get the vaccine?
Absolutely. The governor, he's right on. He's 100% correct. 99.2, I believe, was the percent of people who are seriously ill or who died were unvaccinated. So you may hear stories, oh, my friend was vaccinated, he still got sick. You might test positive and you might be mildly ill, but you're not going to be in the ICU and you're not going to die. And that's the purpose of the vaccine, is to diminish the symptoms. And I have to commend Mayor Curry for his same message. The one thing I would say, though, is the house is on fire right now. And we are talking about a vaccine which will be fully effective about 6 weeks down the road if you got it tomorrow. So we need to implement as many things that we can do as individuals to try and stem the tide, because we know how this goes. It's cases and then deaths in that order. And right now we're seeing this huge surge in cases, and we need to do something right now about it. I'm not saying we need a mandate, because I think people know what the right answer is to help their community. You're either going to help the virus by not wearing a mask, or you're going to help the community by wearing a mask. And it's really a personal choice.
So, Dr. Staats, I saw Pastor Newman nodding in agreement when you said the house is on fire. And because of that, I think there's much more to talk about with this COVID surge. So we're going to continue doing that, including when we come back from this commercial, we're going to talk about what's happening in the Black community concerning vaccines. That's next on This Week in Jacksonville.
Hardee's. Cool ranch chicken sandwich, no they breaded by hand. I'm gonna get my hands BLT ranch in my hand. There's 100% chance of a BLT.
Celebrate this summer with the new BLT Ranch hand-breaded chicken sandwich from Hardee's. Feed your happy.
Being injured in an accident is only the beginning of your problems. Don't throw away your one shot at compensation. Make it count. Fair and Fair.
Welcome to Toyota's National Sales Event.
Ooh, RAV4.
It's a great time to save on the 2021s while they last. Ooh, Venza! Toyota's got an exciting lineup to choose from.
Oh, Highlander, could you?
Oh, sure. You have to understand, it's the National Sales Event.
Right now, during the Toyota National Sales Event, get 0% APR for 36 months on a new 2021 Toyota RAV4. That's just 0% APR on the Toyota RAV4.
Hey, that's my line.
Toyota, let's go places.
After a long night of bringing home the bacon, there's nothing wrong with a nice, smoky nightcap. After all, it's 5 a.m. somewhere. Hormel Black Label Bacon. Make it.
Introducing Wendy's new Spicy Black Bean Burger. Bold, spicy, crunchy. You know only Wendy's could bring you flavor this amazing. It's not just good for a plant-based burger. This is good for a burger. We got you with our Spicy Black Bean Burger.
Getting back to all of this will take all of us.
If you have questions about the vaccines, Florida Blue nurses are standing by for your call. Florida Blue, your local Blue Cross Blue Shield, here for the one place we call home.
It takes lots of innovation to keep costs down. Mega amounts, like making our state-of-the-art natural gas plants ultra-efficient, which, by the way, has saved all of us billions of dollars. Tons of ideas, countless innovation, always keeping an eye out for savings.
Kicks for the Kids is collecting new shoes for children in need.
You like it made from scratch?
We know you do.
How about hot and hand-breaded?
That looks crispy.
First thing in the morning.
Not your grandpa's biscuit.
The new hand-breaded chicken biscuit from Hardee's.
Feed your happy.
Let's go shopping. I looked so optimistic.
Back to school with Lauren Verno.
This was so frustrating.
You need 5 glue sticks.
Why do you need 5 glue sticks? You've got this under control.
This is really hard.
But then you realize you really don't. Looking at lists, county by county, when it's better to cut your losses and shop online, and when it's better to come in person and save some money. And I'm giving everything I bought to one lucky insider.
Stress-free school shopping. Wednesday at 5 p.m. on News 4 Jax.
Sign up and sign in.
You're watching This Week in Jacksonville with Kent Justice.
The statewide coronavirus vaccination community education and engagement task force met this week, and they made an urgent plea to Floridians to get vaccinated as the state saw new cases nearly double over the last week. The task force is primarily focused on encouraging Black Floridians to take the vaccine. The current vaccination rate among Black Floridians, I heard this week, was 26%, and that's compared to about 43% of white Floridians. Task force chairman Reverend R.B. Holmes from Tallahassee pushed other members to double their efforts in light of what he described as a deplorable Black vaccination rate.
Somebody said the definition of madness is doing the same thing the same way over again and expect miraculous outcome. It doesn't work that way. We as pastors and leaders, bishops, we must be the ones advocating for our people. We allowed a lot of things happen prior to COVID-19. That's why minorities and people of color have died and gotten sick at disproportionate rate. It's a moral call.
So Dr. Nancy Staats and Pastor John Neman are with us. Pastor Neman, do you agree with this effort by Reverend Holmes and others?
Absolutely. For those numbers to be so low in the African-American community is really, really hurtful just even to hear. Oftentimes in the Black community, things lag in the community and oftentimes last. But in this particular case, we need to really get to the front of the line because there's so many people who can infect so many more people simply because they're not vaccinated. And there are people in different buckets, Kent. For one thing, you have the elderly who can remember Tuskegee and other things, I don't know, lax and the like. But then you have younger people who think they're impervious. They think, I'm fine, I'm young, I'm strong. And as our viewers saw on Thursday, a young man who was just that and then wound up running 8 miles one day, excellent health, and then on a respirator within 24 to 48 hours. It can happen to anybody. We need to get our community vaccinated.
What are some of the things that would work to change this? Dr. Staats, what do you think? Do you think incentives work? You know, some businesses, some states are encouraging vaccination. They're offering money or prizes or that kind of thing. Is that important here?
I can't say that I know the exact answer in Jacksonville. What I would say is there are probably 2 or 3 main barriers. The first barrier is people might be concerned about side effects and also the fact that they feel that the vaccine was quote unquote rushed and is not fully FDA approved. And what I would say to that is, while the initial study only looked at 40 or 50,000 people, which is why it's an emergency use authorization, we have since administered over 160 million vaccines to Americans, to all types of people. The incidence of side effects, while it's never zero, is actually safer for this vaccine than for many other commonly used vaccines. Vaccines result in a better quality of life and have saved countless lives through the ages. So that's one. And then the other is some people, there may be a practical difficulty. They're worried they can't work if they feel ill afterwards. So perhaps there is something we could do to help alleviate that stress on either employers or other people offering more weekend vaccines. But honestly, I think the biggest hurdle is people deciding where to get their information and trying to get it from reputable sources, and really talking to doctors and people who understand the science.
Yeah, I can appreciate that. Pastor Neman, I would hear from you on this. And you referenced it a moment ago before we had that commercial. From a spiritual perspective, is there something that you would say to persuade someone they need to get the shots?
Yes, kind of dovetailing off what Dr. Staats said in terms of incentives. I don't know what the actual answer is to that, but I can tell you this. The statement that comes from the place of faith is loving your neighbor as you love yourself. If you love you, protect you. If you feel like, well, I'm okay, I think I'm fine, but let's say you have a loved one you're concerned about, you love them, then receive the vaccination because you love them. And any parent would see a car careening down the street and their child in danger, would immediately run out to save that child and risk their own lives to do that. Well, that's what we're talking about. Doing what is necessary to save not just only your life, but the life of those who you care for. Love your neighbor as you love yourself.
And I think what Dr. Staats just said, some people, the suspicion that is there, a lot of that can be based on maybe misinformation. So really important to find someone you trust who is an expert in the field and choose them to get that information about whether or not a vaccine is right for you, because what we know is for our society, getting rid of coronavirus is what's right for us. Pastor John Neman and Dr. Nancy Staats, thank you for your time and your efforts in this for our community.
Thank you for inviting me.
Thank you, Kent.
So in just a moment, City Council's Ron Salem is with us. We're getting an understanding of the process ahead as Jacksonville's budget proposals get weighed and discussed. Stay with us. That's next on This Week in Jacksonville.
You've got enough to think about maintaining. Good thing the all-new 2022 Volkswagen Taos has a lower cost of maintenance than Toyota RAV4. Come into your Volkswagen dealer today and lease the all-new 2022 Taos S for just $229 a month.
If you've been injured by medical malpractice, call Farah and Farah for a free review of your case, even if another firm has turned your case down. Farah and Farah.
Whoever made this weird nugget gave up hope. But whoever made Arby's new 100% chicken breast nuggets really cares. A lot. The most. 2 for $6. Arby's. We have the meat.
The next time you head to Florida, expect an even warmer welcome with Easy Pass. Now you can use your Easy Pass to pay for tolls on Florida's toll roads and most bridges. Take advantage of more convenience and more savings with one toll account, all across the Sunshine State. After all, on vacation, shouldn't everything be a little bit easier?
Dude, this thing is awesome. I know. I bought it using the Cash Rewards card from Navy Federal Credit Union. I get cash back on every purchase. Honestly, I can't imagine where I'd be without them. One word. Got it. Reeling in fish. No. Eating fish. Fish in the sea? Movie.
Navy Federal Credit Union. Our members are the mission.
With Week for Life scratch-offs, you can win up to $5,000 a week every week for as long as you live. Yeah! Experience lifelong excitement with Week for Life scratch-offs from the Florida Lottery. It's your ticket. Claim it!
I had one goal after my brother Tim's accident, build an injury firm my own family would hire. As America's largest injury firm, there is no firm I would ever hire but ours. Reputation matters, results matter. There's only one Morgan & Morgan, for the people.
Prepare your taste buds. Kit Kat Duo's mint and dark chocolate.
Kit Kat Duo's mocha and chocolate. Have a break. Have a Kit Kat.
This Checkers Baconzilla is for Diego because he just pulled some overtime. So Checkers pulled out all the bacon, melted cheese, and 100% beef patties. Baconzilla time has begun, Diego. You've earned it. Get it delivered through our new rewards app.
Exact Track 4D. Cutting-edge technology to keep you safe.
You've got enough to think about maintaining. Good thing the all-new 2022 Volkswagen Taos has a lower cost of maintenance than Toyota RAV4. Come into your Volkswagen dealer today and lease the all-new 2022 Taos S for just $229 a month.
You're watching This Week in Jacksonville on Channel 4.
In this segment, we're tackling a billion-dollar topic. Jacksonville's proposed budget for 2021-22, it's actually $1.4 billion. Mayor Lenny Curry delivered his vision to City Council this week. And as a headline, Curry's spending plan shows an increase overall and some new priorities. Here's a portion of what the mayor shared.
We're proposing $500 million of projects that touch every corner of this city. Here are some highlights. $24 million for county-wide road resurfacing, which is double the previous annual commitment to our roads and streets. $50 million this year for parks, pools, libraries, and other quality of life enhancements, and another $50 million in year 2. $54 million in drainage and resilience projects in the next fiscal year.
Mayor Curry talked about pay increases for all city employees with an emphasis on police and fire. And one of the most expensive lines in the budget is the money going to the sheriff's office. The mayor's looking at a $29 million increase for JSO. The sheriff has said a portion of that will go to fight cyber attacks and will make major upgrades to the department. Now, some community activists who were at the budget presentation, they questioned if the sheriff needs that much more money. And they said that they'd like to see it go to social programs instead of just crime fighting. Joining us right now, Dr. Ron Salem, the chairman of the City Council's Finance Committee, and eventually I know there's a citywide vote on, or a City Council-wide vote on the budget. What's the process in between now and then, the then being sometime in September, I think is when you vote, right?
Well, first, thanks for having me, Kent. The budget has now been turned over to our council auditor, Kim Taylor, and her staff. They'll spend the next 3 weeks or so going over the budget, and then we will begin hearings on August 12th. It's 3 weeks of hearings, basically 4 to 5 days a week, 8 hours a day. Myself and my 6 colleagues on finance will review every department, go through it, possibly make adjustments depending on what's presented by the council auditor.
I know that one of the things we've talked about, there's a lot of COVID-related money coming into the budget this year. And as I understand it, that happens in 2022 as well. So it's this year and next year?
That is correct. We are receiving $171 million this year in the American Rescue Plan and another $171 million next year that must be spent within a 4-year period. And I think the Curry administration and his staff have done a nice job of incorporating those dollars into predominantly the capital improvement plan, because it is one-time money and we need to ensure we're not creating recurring expenses with those dollars.
So let's look at that. We've got a graphic here, what the capital improvement plan will look like. And just again, some of the highlights, but $24 million, this is countywide roadway resurfacing, $50 million for parks, pools, libraries, other quality of life enhancements, $54 million for drainage and resilience projects, and then $50 million is the first year of the septic tank phase out here. How do you feel about those as priorities for some of that money?
Well, I'm very excited, first of all, for the septic tank phase out. I supported
long time coming, right?
Right, and I supported the gas tax, which was predominantly enabled that to occur. I'm also very excited about the Parks Initiative. There's been a committee set up, chaired by Councilman Randy White, by President Newby, who will chair a 7-member committee that will determine how those dollars are spent. And it's $50 million this year and $50 million next year. So we should see significant improvements to our parks, libraries, et cetera.
Yeah. So capital improvement projects there, are you in favor of most of that $170+ million going to those kind of items?
Yes, because you have to be very careful, Kent, because that money's going to disappear in 2 years. So you need to ensure we're not creating reoccurring expenses, such as if you hire 10 people with those dollars, you've got to pay their salaries beyond this money. That's not a good idea.
Unlikely you'd hire them for 2 years and say, see you later after
That's exactly right. So accelerating the CIP with these dollars is, in my opinion, the prudent way of attacking it.
You and I, had, preparing for today's interview, talked about some different things. I want to show you a list of kind of various projects for the city that will come up. One of them, $7 million. This is bridge replacement and widening. $10.5 million for bulkheads, $50 million. That's what we talked about, the septic tank phase out. So that's the first year, but it's $115 million over 5 years. And then that resiliency, that's $10 million the first year, $50 million in 5 years. And drainage improvements, when you see a big number like $106 million there, that kind of goes to how important that is, right? How maybe overdue some of that drainage improvement is.
Well, we've just hired our resiliency officer who started in the last week or so, and I think there's a big push initiative to begin addressing resiliency in a major fashion.
Yeah. Some of the other things that are going on there, $19 million for a civic site attraction, Riverwalk at the shipyards, and you see some of the other things there. How does that first one factor in? What would that, the Riverwalk and shipyards and that money go to?
Well, the plan is to extend the Riverwalk all the way down through the shipyards, down to Metropolitan Park. That's the major expense there.
Would that connect to that development plan that we're seeing from the Jaguars?
Yes. Assuming it's built, yes, it would.
Right. And it keeps trending toward seeing that happen. Before we run out of time, we know there's $20 million in sidewalks that are happening, 24 road resurfacing. That's a 5-year plan as well. That's like $120 million. Anything that stands out to you as, boy, we're going to have to take a look at that. That might be too much or not enough in terms of priorities for what you want to see in the city?
Really nothing thus far, Ken. I've been very pleased with the way the budget was put together. I was involved in the process several weeks ago as the finance chairman. They came to me, sought ideas on how we should spend those dollars. So there's no surprise here to me. I'm very pleased on the way that it's been put together, and no new taxes, no property tax increase. I'm not looking for anything like that, so I think it's a good budget.
And we've got about a minute or so left, but there have been times in the past when we've seen budget proposals come out and it's fairly divisive. Not the case here?
I don't think so. I think President Newby, myself, and the other finance committee members that I've talked to are pretty pleased with the budget. I'm not saying there won't be discussion, potentially moving things around a little bit, but I don't see a whole lot of that. The divisive issues such as property tax increases are not going to happen. I don't see any significant fees or anything occurring, so I think it's a really good budget.
Yeah, and this, as we mentioned, coming in out of our commercial, is a wildly different topic than everything going on with coronavirus and everything, and I know you're kind of on the front lines there, participating in the vaccination effort for the city. We appreciate your time this morning and best success over these next couple months.
Thank you, Ken. I appreciate it.
All right. Jacksonville Civic Council has decided to get involved in vaccine efforts as well. Gene Miller is going to join us next week, and we're going to get a look at the plan to get Jax vaxxed. That's a new campaign that's going to come up and start this coming week as well. And this week in Jacksonville, we air each Sunday morning at this time. So thank you for joining us today. I'm Kent Justice. Thanks for watching on air on Channel 4. You can see us on the CW 17 at noon on Sundays, and you can always find this episode and others online at news4jax.com.
See why every day more people are choosing News 4 Jax, Northeast Florida and South Georgia's #1 source for local news.